Thank you for joining me today for an episode of the Healthy AF podcast. With me is Andy Schoonover from Crowd Health. Andy, thank you for joining me.
Thanks for having me, man. Good to see you.
Crowd Health, if you're not familiar, is an alternative to health insurance, which at some point we all need, right? We need a little extra backup in today's health or medical environment. And so this is an alternative that I thought everybody should hear about. Applies to, I think, many people's situations where health insurance is becoming almost unaffordable unless you've got an employer paying for it. And even then, you still have a decision to make. But Andy, thanks for joining me. This is a kind of a revolutionary project you've got going in here that's really, really off and running. I had the pleasure of meeting you at the Alternative Health Summit in Nashville in June, hosted by the Meat Mafia. So that was great. And I appreciate you coming on to kind of speak to my listeners here about this alternative because, again, much needed.
Yeah, thanks for having me.
Let's unpack it real quick. Just let people know what is, in general synopsis, what is Crowd Health?
I'll kind of back up a little bit and kind of give you the issue that I had, because I feel like a lot of these companies are a result of, the founder or a group of people having some kind of pain that they learn from, and they're like, okay, I'm gonna change this, right? So this is actually my second healthcare company. I never thought I was gonna do another one after the first round, but sold that company, and as such, I didn't have health insurance because most of us, get health insurance from our employer, and so I wrote off of that and got onto healthcare.gov because I thought it was my only option, and I kind of joke with people it worked until I had to use it. I got a bunch of little ones, and my littlest, who was 1 at the time, was having recurring ear infections, and so we went to the ear, nose, and throat doctor, who said that she had a hole in her ear, a perforated eardrum, and that she needed to get tubes in her ears. So they're like, okay, great. So we went and got tubes in her ears. It was in-network provider. Got the bill a few weeks later, and it was $8,000 for a 15-minute procedure.
Wow.
I was just like, holy crap, $8,000 for 15 minutes. I need that hourly rate, right? I went into the wrong business. And I was like, okay, well, this is what health insurance is for. Like, this is the whole point of having health insurance. Well, little did I know, a few weeks later, my health insurance company sent me a note that said it was medically unnecessary, so they weren't going to pay for it. And so I was like, hold on a second. Like, my ear, nose, and throat says she's got a hole in her eardrum, and you're telling me it's medically unnecessary? Like, this is absolutely crazy. But I went through a couple rounds of back and forth with them, and my ear, nose, and throat doc got involved, and the appeals process and all that kind of stuff. At the end of the day, they wouldn't pay for it, so I had to stroke an $8,000 check to the provider who did it. And as you can imagine, I was pretty pissed. So I called the health insurance company and I said, all right, like, if you're not going to pay my bills, I'm not paying your bills. And so I became uninsured. And so to a lot of people, that is a scary word. But for me, my wife, and my family, we're like, all right, we're just going to figure this out. And so over a period of time, we figured out how to viably operate outside of the kind of legacy health insurance space system. And man, we just found freedom in that, and no doctor networks, and you don't have to worry about who you go to and all this kind of stuff. And so I was like, I think other people would benefit from a company like this, or a company that could bring together all these tools to allow people to do this. And so in essence, what we did is we started a company. So we started Crowd Health in 2021, and it's tools to allow you to pay for healthcare expenses that are small, whether it be a pediatric visit or a primary care visit, or big, like cancer or a NICU baby or a brain hemorrhage or a motorcycle accident. And so we've signed up over 6,000, almost 7,000 customers now over the last couple of years. And we've dealt with 10,000 bills. And, thus far it's worked perfectly, beautifully. And so that's what we're up to.
Wow. That's amazing. Well, so you had obviously a background in healthcare. You understood how the system worked, and you found a way around that. So how does that function? Like, where does the money come from? And what's the cost difference between standard healthcare and, what you're offering?
Yeah. I mean, I call it a little bit like Back to the Future, because, like, for hundreds of years, if something happened to us, then we'd have the community come around us and help us. And kind of in the agrarian community, that would look like we'd come over and we would, plow your field or sow your seed or whatever it ends up being. And I feel like over the last 40 or 50 years, we've lost that sense of community, and I think a lot of it is like, we don't feel now responsible for the next person over because either the government or insurance companies or whoever kind of has put themselves in between us and our neighbor. And I think that's a travesty, like 20 or 30 years ago, when somebody joined you in your neighborhood, you'd bring cookies over to them. And now it's kind of like, well, it's how much did they buy their house for? Because that's, an indicator of how much my house is worth. It's like our community really has gotten warped. And so what we're trying to do is say, hey, can we bring community back to healthcare? And so in essence, what we've done is we now have thousands of people who have raised their hand and have said, hey, if somebody in my community gets hurt or injured or has a baby, I'm willing to help them. So let's just say that, Zane, I see, your Instagram videos, you're pushing heavy stuff around outside, right? You're doing all this stuff and you, something bad happens to you, like you tear your ACL or something, right? And that's $18,000. Well, we would go to 180 people in our community and we would say, hey, would you help out Zane $100 each because he tore his ACL? And so imagine you have like a Venmo account. Everybody understands what a Venmo account is. And you have 180 people sending you $100 so that you now have $18,000 in this Venmo account so that you can go and pay for your ACL surgery. Now, we don't use Venmo. We use something like it, but it's a similar idea. And so when you go to your orthopedic surgeon to get your ACL repaired, you can actually pay him at the point of care for that ACL surgery. And the beauty of this is that the surgeon will give you a significantly better price than what they charge a health plan because they're getting money at the point of care, as opposed to having to fight with the insurance plan and get the money 3 or 4 months later and all these kinds of things. And so the prices we're getting for our members are about 50% less than what, United Healthcare and Cigna and Aetna have to pay for services. And so that's why it's so much less expensive to go with Crowd Health than with others. So, Crowd Health is $185 a month per person, $605 for a family of 4, and, and all kinds of things in between. But, it's significantly less than if you were to go on healthcare.gov or, one of these other alternatives.
Oh, for sure. For sure. And I mean, that's kind of like how healthcare used to be when we had community hospitals. We didn't have healthcare organizations that were traded on the New York Stock Exchange and had a profit motive. With community hospitals,
exactly,
like when I was kids, or at least definitely when I was born in one. And there used to be one here in Williams County that was recently purchased, or the community was supported by the community by some tax revenue, obviously to make it affordable. But the rates were more affordable, and people could actually pay out of pocket. Like back to the 60s and 70s, people were just writing checks for their health.
Yeah.
Like like I said, having babies, surgeries, all that was an affordable rate that people could literally write a check from their normal income.
My brother's 55, and I think my mom has a receipt from the hospital for his birth that was like under $100. I mean, it was like nothing. And now a birth now is like 17,000 on average in this country. So that's the difference. One of the things that I think is like so beautiful about our model is that, every month you write a check to United Healthcare or Cigna or Aetna. In our model, you're actually sending money directly to somebody in the community who needs help. So, my money goes from me to Zane to help him with his ACL. There's nothing in between Andy and Zane. It's me to you. And so, if you imagine like sending your monthly check to another human being to help them directly, as opposed to sending it to some big corporation, there's something super cool about that. There's something human about that, right? We had a member in Tennessee, actually in your neck of the woods, and who had her fingers, 19-year-old, name is Abby, who had her fingers chopped off in a boating accident in last summer. And, this was tens of thousands of dollars worth of bills. And so we went out to our members and they funded Abby. And, a bunch of them called in and were like, man, like, I can't imagine being a 19-year-old and not having, basically a hand, So instead of $100, can I give Abby $200 this month? Right? Like you would never call United Healthcare and say, can I give you more money this month for my premium? Never. Right. But since you're giving it to a human like Abby in Franklin, Tennessee, who, that a little bit of the story, you're like, man, I want to give that money. Like imagine wanting to help, give your money for your healthcare every month as opposed to being like, I got to write another healthcare check this month, So it's just a totally different way of looking at this. And again, it's like, let's bring back the community component of this.
That's amazing. Wow. Yeah. I mean, you actually feel good about your healthcare dollars.
Yeah.
So you guys are
exactly
negotiating for a lower rate as well as funding from your community. I assume the community's at this point I'm thinking early adopters, obviously this is not like, so you've got probably a very, say, free thinking, but very outside the box thinking community. Do you have any sort of health markers or health questionnaire or anything like that as people join? Or is there some sort of like, typical with health insurance, they want to see a physical. They want to know what your habits are. Do you smoke? Do you drink? Do you,
sure.
Is that a part of your membership or is that something that
there's a couple
kind of a framework for?
Yeah, there's only a couple requirements. One is you have to be under 65. So Medicare, it just doesn't work with Medicare for some regulatory reasons that we can get into if you want to, but they're kind of boring. And then smokers and anybody over 240, unless you have significant muscle mass, which we will make an exception for. I was talking to Sean Baker, Dr. Sean Baker, who I'm sure you know, and I was on his podcast a couple weeks ago, and he's like, I wouldn't qualify. I was like, no, you would be one of those exceptions because I think he's 6'3", 280 or something. He's just that
in his 30s. He's probably closer to 235, 240 right now. Yeah.
Okay. He said he wouldn't qualify, so he's over 240. That's what he said.
240. So. It's like
no. So we have a few biomarkers, if you will, but again, the people who are self-selecting into this tend to be healthier. Our BMI is about 4.5 points lower than the national average, and so you are helping people who are healthy, trying to live a healthy lifestyle. We have a very high percentage of keto, carnivore type of folks. So these people who want to treat their body right. Lots of people who work out. And so it's a good group of people. And I think that's it. What was a great indicator of this is our top two requests for funds. Number one is pregnancy. So about 40% of our funds go to pregnancy. Interestingly. 30% of our funds our community's funds goes to active injuries. So these are people outside doing things, being active, having, face plants of their mountain bikes, pushing around heavy stuff and tearing ACLs. We had a pickleball ACL tear a few months ago, like people outside doing stuff. Right. And so, I'm all about helping people having babies. And I'm all about having people who are having active injuries that just stuff happens. Like, I don't care how good you take care of your body, just stuff happens, And so that's where your money is going towards. And it's not going to subsidize, unhealthy eating habits and chronic conditions and things like that. And so you've got a great group of people. Average age is 34. And so we have a younger group as well. So it's pretty good. If you're funding each other's healthcare needs, it's a great group to be a part of. So we're excited about the community there.
That's awesome. That makes sense. That's the prime age for having babies too. I mean, that's just
yeah.
I remember. Yeah, we could have used that when we were having those kids, for sure. It got expensive. Well, that's great to have such a healthy community to pour into as well. I mean, you're funding good habits.
Yeah.
You feel like you're
making
place where you go through a hospital, 80% of the people in there at least are there because of poor lifestyle choices. Like they have
totally
due to their lifestyle choices. That we all know metabolic disease gone rampant, in its various forms, various symptoms.
And most of our people too are entrepreneurs. Like, it's young entrepreneurs too. So it's entrepreneurs, gig workers, freelancers. And then, funny enough, after that group, it's doctors and nurses, which is kind of a funny thing. And so it's like, I think they see what is happening at the bedside level, and all the craziness that happens with insurance. And I'm like, I don't want any part of this system. The number one reason why doctors retire early and get burnt out is because of the bureaucracy of health insurance. And so they're sitting here saying, like, I don't want out of this system, get me into a new system. And so, we think it's a great solution for people who either are currently entrepreneurs or want to be entrepreneurs and aren't quite sure, where they're going to get their healthcare from. There's an article from the RAND Institute. I read it recently. I think it's 2 or 3 years old, but 2 to 4 million Americans would quit their corporate job and do something entrepreneurial if it weren't for the cost of health insurance, And for me, it's like, man, that's un-American. The fact that health insurance is keeping people from going and doing something, entrepreneurial. I mean, that just sucks.
No, it's definitely what people look at when they consider their benefits package, when they're looking at like apply it at jobs. And definitely young people too. My wife and I, we joke we're not employable. We're chronically self-employed, and we've had to make do. There's times when it was very, very difficult to handle that. We found an alternative for us that worked within the state of Tennessee. But if we moved outside the state, we'd have to start looking for something. And we've grandfathered in for more than 20 years. You couldn't find that again. You couldn't find what we have now. Well, the reason we're still in it or we have it is because we've been in so long. And, but there's no way, I mean, there's no way I would let something like insurance stand in the way of being self-employed.
Yeah.
Like that's just the kind of person, kind of life I want to have, kind of person I want to be.
Yeah.
And I think there's a lot of people, you're right, that would make that leap if they knew they could cover that, because it's such an outrageous expense, and the fear of something going wrong for medical expenses, it can be in the tens of thousands very quickly. As you found out from something as a simple procedure. But yeah, self-employed, I mean, people want to retire early. Maybe someone who sells their company and they get a big payout. They want to do stuff on the side, maybe not have a hardcore job, and, they want some sort of health insurance. And I think about my kids who are in that career age. I got 3 in their 20s, and they're going to be aging out of our insurance pretty quickly, going on their own. And they're going to have to make those decisions about where they work based on sometimes on health insurance, and to have an alternative. And they're pretty healthy. I mean, just saying overall, they're healthy kids, and to be able to have that kind of alternative choice that one, they don't have to worry about where they're working, providing it, and two, to save unneeded dollars going the wrong direction, and,
right.
and that age group, it really, I think, appreciates community. They really do start to appreciate community.
It really is sad that we have to choose our life, paths based upon health insurance. Your kids shouldn't have to choose where they work or don't work based upon the healthcare, right? The people who are listening who are healthy AF shouldn't be choosing whether or not to sell their businesses or retire or whatever, based upon health insurance. So, I think that's one of the things that I'm just super fired up about, is giving people, options that enable them to go and go after other cool career paths or end their current career path if they want to. So it's one of the cool benefits of Crowd Health. So, we're a pretty missional group. This is not one of those things where I sold my last business. I don't particularly have to be doing this, but this is something I'm super fired up about, because, man, it's not only that, but it's one of the things I realized, Zane, when I did some research, was 200,000 families every year who have health insurance go bankrupt due to a medical event. Like, this is, you have health insurance. Like, the whole point of having health insurance is, something bad were to happen, it doesn't put you into financial distress. And the fact that we have 200,000 families every year going bankrupt, even though they have health insurance, is a tragedy to me, And so the way that we've structured ours is like, it's two reasons. One is these health insurance plans deny claims, so in the Obamacare deal, about 17% of the claims are denied. And so like mine, like I was in Obamacare, mine was $8,000. I've been super fortunate. I can pay $8,000, but like the majority of people out there can't pay $8,000. Right. And then the other thing to think about too is like these deductibles are so high that if you do get hurt and have something major, you could be out at $8,000, $10,000, $12,000 because of these really, really high deductibles. And so it's like crowd health is if you go to the ER, it's $500. If you break your arm, it's $500. If you tear your ACL, it's $500. Like, you'll be out $500. And then anything above that, we submit to the community to help you out. So, the last thing you need to do while you're sitting in a hospital is worry about, how am I going to pay for this? Everybody should be able to come up with $500,
Deductible. You're like,
yeah,
that's
yeah. And this is the cool thing too, is like, we've had a bunch of cancer cases. A cancer case could be 50 doctor visits and a couple surgeries and a bunch of prescription drugs.
Yeah.
You're in for $500. It doesn't matter if it spans year over year. It doesn't matter if it's 2 visits or 20 visits. You're in for $500. And so, we just think that's great, because there's been nobody on Crowd Health that has gone, bankrupt due to a medical event. There's been nobody that's had to put this stuff on, big medical events on their credit card, from what we know. And so, like, that's the way that this should be, right? And so, that's one of our major missions, is people shouldn't go bankrupt due to their healthcare. So far, so good.
Yeah. Well, maybe you can unpack for the listeners how we got to the situation where everything became so elevated with our medical costs, and then you guys were able to turn that on its head and really bring those costs so far down. You said at least 50% reduction in cost.
Mm-hmm. Yeah. I mean, it's one of those things where people look at healthcare and they're like, oh, this is so complex. And I was like, you know what? It's not really complex if you think about it, because you've got these hospital systems and they're buying up, all kinds of other hospitals and trying to create these huge organizations, huge corporations to, have a little bit of power over the pricing. But you have them, they want to make as much money as possible, which they're selling a service. I get that. Right. On the other hand, you have the buyers of healthcare, which are these health plans, and you would think that they would want the prices to be low as possible, but they actually don't. And here's the reason why. There's a law that says you can't profit more than 15% of premiums. So if your family, just to make the math easy, has $1,000 of premiums, the max that the health insurance plan can pay it or make is $150. Well, everybody wants their profit and income to go up, right? So how does your income go up from 150? How does it go up by 10% to 165? Well, your premium has to go from $1,000 to $1,100 for them to make more money. So they actually have an incentive to see the prices of healthcare over an intermediate or long period of time go up. So if the buyers of healthcare want the price to go up and the sellers of healthcare want the price to go up, the price is going up. And so what we're trying to do is say, no, we actually are now incentivized for the price to go down, because we're fighting on behalf of our members. And so we go in and we negotiate, and by paying in cash, that doctor doesn't have to have the billers for health insurance. They don't have to spend 30% of their time fighting the insurance companies to get paid. And so all that bureaucracy disappears. And they're now able and willing to give you a much, much better price, because they don't have to. And so that's in essence why we're able to get much, much better pricing than, a health insurance plan. Our United Healthcare, which is like the 7th largest company in the world based on revenue. Our members are getting better rates than United Healthcare.
Wow. Just by negotiating. So you guys have established relationships with these healthcare providers. You just call the hospital directly and start saying, hey, we're a cash payer.
Yeah. So,
we can give you this now versus you wait 6 months to get paid by the insurance company or whatever.
Exactly. Yeah. It is a one-off by one-off deal. We have an outsourced group that does that for us. So if you have an ACL tear in basically any city, or a colonoscopy or whatever in any city, they will go and they will find you a great provider who will give you a great rate, cash rate for that procedure. So all we do is if somebody has a big procedure coming up, they call us so that we can go and find them a great doc. And so that's the only kind of not the only difference, but one of the main differences between us and health insurance is like, look, if you have something big, just call us so that we can, help you find a really great doc. Or if you have a great doc, let us negotiate with that doc so that we don't pay, egregious pricing for the healthcare. Right. And so that's the real kind of one difference, or the major difference between us and the way that you'd pay for your healthcare with health insurance.
Gotcha. That makes sense. Yeah.
Mm-hmm.
So but everybody wins basically. Everybody wins. The
Yeah,
hospital
everybody
wins.
wins.
The doctor wins. Yeah.
Yeah, and the only people that love us more than our members are doctors. Like the doctors are like, please, let me, have more of your members because I want to get paid in cash. And in essence, what's going on is that these health insurance plans are micromanaging these doctors and have this very set formulary for how you can practice medicine and actually get paid, right? And so what we're doing is we're saying no, this is between the patient and the doctor. You all need to figure out what the right, path of care is, not an insurance company. And, so far over 10,000 bills, that has just worked so well. And there's freedom in that. And the doctors are happy and the patients are happy. And, they're not getting all these denied bills and things. And so it's just, again, like you said, it's a win for everybody. Right.
So, so in addition to saving money, you don't have the stress of worrying about what's going to be approved or not. Hey, this $500, everything's taken care of. It doesn't matter. There's no oversight from some insurance, adjuster saying, hey, we're going to cover this, but not that. And because you were, you had a pre-existing condition, or because this is not work related or whatever it is, anything they think of is not medically necessary, which it seems to be
medically unnecessary, right?
Medically unnecessary. We're not going to pay for it. Oh, what a surprise.
Yeah. Well, the other thing too is these networks that you have, people are so stressed out about is my doctor in network or out of network? Or, it's the first thing that my wife always asks me, is my OBGYN in my network? Because I love her and I want to make sure I can go to her and all these kinds of things. You don't have to worry about that anymore, which is awesome. And then the other thing too is people don't realize this is if you go to a hospital, most of the doctors in the hospital don't actually work for the hospital. They work for another company that the hospital has outsourced to. And that company, even though the hospital is in network, the company that is providing the service might be out of network. So the emergency room doc may be out of network. The anesthesiologist might be out of network, and so you have to keep track while you're in the hospital, who's in network, who's out of network. And so, I kind of joke, but it's nearly impossible to navigate the system with normal insurance. The great thing about Crowd Health is you go into the hospital, it doesn't matter who's in network. There is no networks. And so it's just rest assured that, you're going to go in, you're going to get great care, and then you're going to come back out and you're going to submit these bills to the community. And thus far, the community has been just incredible at getting these bills paid, and you have an organization on your team, an ally with you to fight for you to get these bills paid. I always hear it. I don't know if you feel the same way, but somebody has a big health event and they're like, now I got to go fight the health insurance company, right? I got to go fight to get this bill paid, right? And it's man, with Crowd Health, it's no. We're on your side to get your bill paid, as opposed to battling you to get your bill paid. And so, man, it just turns the entire system kind of on its head. And that's one of the great things about the way that we operate.
Absolutely. Wow. That's a lot of solutions. It's for self-employed people want to go out on their own, or early retirement. And you really just can't go wrong with just wanting cheaper insurance anyway, whether you're employed or not. It still might end up being just the stress alone of not having to, like what you just said, negotiate whether you're covered or not. That alone, even if you have it provided by your employer, could be enough to say, what, $500, and I don't worry about anything else. That's peace of mind. That helps you sleep better at night.
I think it's great. The number one barrier to people signing up is this is so different. Can I trust that y'all are going to help me get my bill paid? And, the thing is, insurance is out there saying, we guarantee that your bill is going to get paid. But, 48 million claims on Obamacare last year, or maybe it was 21, it was the latest data that they have, got denied. And so, thus far we've made it through 10,000 bills, and everyone submitted to the community has gotten paid. And so while we can't guarantee it, we've done a really nice job of getting those bills bills paid. So that's our number one, challenge for people is will you help me get my bills paid? And, so far so good. And, we've got every incentive in the world to fight for you and your family to get those bills paid because, our worst case scenario is somebody not getting their bill paid and then going on Twitter or Instagram or something and say, this company, didn't help me get my bill paid. I mean, that would be a disaster for us. And so we, work our butts off to get you, get you that money and to make it easy. The process is really easy. The mechanics sound a little bit different and weird, but the process is super easy to get your bills, submitted to the community and get paid. So yeah, it's been a great service for, I get, like I said, more than 6,000, almost 7,000 people thus far.
How many? 7,000 people you have now members. Okay.
Yeah, almost. We're almost up to 7,000 people who signed up. Yeah.
Oh, wow.
Just short of that.
Have you had any companies to come to you, like small businesses say, hey, I'd love to have this. I'd like to introduce this to my business or my employees. I mean, is that something that is workable?
I mean, it's workable. Here's the way that we structure that is we say, hey, listen, instead of giving your employee insurance, why don't you give your employee a healthcare stipend where they can go and do whatever they want with it, and we will come in and we will say, hey, we're Crowd Health. We think you're your best option. And so we've had a number of companies who've done that and, people love it. So, let them make their own choice with their own money. And that's the best way of doing it. If you have over 50 employees, unfortunately, given the Affordable Care Act, you have to provide insurance to your folks. And so we've worked with some smaller companies, but doesn't work super well for larger companies.
Right. But there's so many small businesses that they have
a couple
of partners, maybe a handful of employees, people to help them out, office staff. And it's super expensive for those, for those business owners to provide some health insurance to a handful of people. They're probably working on narrow margins anyway. And so if you have, 3 to 10 employees, you're bootstrapping all the time. And you really
totally
are. Yeah. And you're just trying to make margins. And so to have that, like, hey, you can get covered. We'll offer you this much as a stipend. Here's your alternative. And at worst, they wouldn't, since they're not required to by law to provide health insurance, it's a nice way of taking care of your employees and letting them know you're looking after them. I mean, it's a benefit that makes you competitive, I would think, in a marketplace where there's a lot of small businesses having a hard time hiring right now.
Yeah.
And so to have something where you can create an incentive to buy or to get it to employ and provide a benefit that, take care of them, their health. I think that could be, again, another win-win for that employer and the employee, who might have to be out there just looking and making less than ideal dollars in income early in their career. Like you said, I think you told me your average person's 34 years old. It's like,
34.
You probably have a lot of 20-something-year-olds too, who are out there just trying to, live.
A lot of 20-year-olds, a lot of 30-year-olds, but we got a lot of 50-year-olds too, like who are in that group of like, I want to retire. I need something for retirement. And, so we love those folks as well.
Awesome. Well, Andy, how do people get signed up or get more information? I know Join Crowd Health is your website.
Yeah. JoinCrowdHealth.com is our website. Join Crowd Health on all of the social media, platforms. If you use code HEALTHYAF, it's $99 a month for the first 3 months, which is about 50% off. So HEALTHYAF, all capital letters. Would love for you to join us. We got a thing. One of the fun things that we do throughout the year is we offer kind of specials to our members. And so January is our, a fully fundable DEXA scan. So if anybody's, into DEXA scans, you get, as a member of Crowd Health, access to a DEXA scan for January. We just had a VO2 max in October, and we'll do the coronary calcium score, I think, in February or March. I can't remember if February or March is Heart Awareness Month, but we do fun things like that. So we'd love for y'all to join us. I know a lot of people, nowadays are thinking about healthcare and what they're going to do for next year. So would love for you to join us at joincrowdhealth.com.
That's awesome. Those are some of my favorite scans.
Yeah.
I personally
I
think,
figured.
keeping track of my own health, like, hey, those are great metrics for if you're creating a healthy lifestyle and you want to know how you're doing, that you can just go out and get, you can go out and get a DEXA, you can go out and get your doctor for your CAC and say, hey, yeah, what is my diet doing? What is my lifestyle doing to me? Well, how's it affecting my arteries? How's it affecting my visceral fat? How's it affecting my body composition?
And that's one of the major ways we're educate people, right? Like we offer these things and people are like, they're like, wait a second, VO2 max? What is a VO2 max? And so we can explain like why this is important and how oxygen intake and how your body uses oxygen and all these things and how to improve it. And so people are kind of like start getting interested about their body and how it works. And so this is one of the ways that we educate people. And as you said, DEXA scan, 95, maybe more than that, don't understand what visceral fat is and why visceral fat is actually way more important than weight, right? In terms of your long-term health. And so we can start educating people on that, because our long-term goal here is, I kind of joke, but it's true, where I want you to be able to play wiffle ball with your grandkids when you're 80 years old out in the backyard, right? Like that is thriving. This is not just about saving money. It's like, how do you thrive? And, another thing I kind of say is like, I want our members to live hard and die fast, right? Like, I don't want you dying of a chronic disease over 10 or 15 years. That's an awful way to go. It's like, let's live really, really well, take care of your body. And when your body is done, then I don't want to wake up someday. Like that's the way I want to go, And so it's like, if we can change that within the healthcare system, I think we can kind of get to another level of thriving in this country that just has been lost. I mean, you mentioned earlier, metabolic disease, 88% of people have metabolic disease, and the vast majority of it don't even know about it. And so, how do we educate people on what your A1C is and your triglycerides and things like that? Well, we offer blood tests. Like, go get a blood test. You can submit it to the community and we'll, help you understand what all that's about. And so these educational components of what we do is really, really important. And that's why I think people who are healthy and want to, biohack and treat their bodies really, really well are really interested in our service, because we can do a lot of things that insurance companies just aren't that interested. They make more money when you're sick. We make more money when you're healthy. So who do you want to, who do you want you to help pay for your health bills?
Right. Longevity is something you've got to do on your own. Unfortunately, as the sick care is all about treating the sick. It's like,
absolutely.
What's the medicine or what's the procedure for addressing the sickness? Was you're saying, hey, let's track your wellness. Let's educate about longevity and wellness and what it takes to stay healthy. Because like you said, once you're sick, longevity doesn't come from surviving sickness. Longevity comes from not getting sick or reversing disease, not managing illness, not managing metabolic disease. You don't live a long or enjoyable life while you're managing your illness. So that's awesome, you guys. I mean, definitely, it's a shift in paradigm shift, really, and in focus. From fear to action, I think, really.
Amen. So come join us. JoinCrowdHealth.com. We'd love to have you.
Healthy AF is the code.
Healthy AF is the code. $99 per person for 3 months. So, a lot of people are like, hey, you'll just dip your toe in the water and see how it is. And if you like it, stick around. And if you don't like it, okay. Like it costs you $99. No big deal.
Right. Awesome. Well, thank you, Andy. Appreciate you sharing this. And, man, I'm going to direct everybody towards Join Crowd Health at Join Crowd Health. Awesome. Andy, thanks so much.
Thanks, man. Good seeing you.